This case study focuses entirely on the effects of anabolic steroids on athletes and bodybuilders. Anabolic steroids, a group of steroid compounds that chemically resembles the male sex hormone testosterone, also known as anabolic androgenic steroids. Anabolic referring to muscle building and androgenic referring to increased male sexual characteristics. The main function of anabolic steroids is to induce protein synthesis. This works by steroid receptors receive steroid hormones that initiate protein synthesis of the ribosomal and messenger RNA, with a resultant accompanying increase in protein building enzymes at the ribosome level. This produces an increase in transcription and translation of genetic codes. Following this further, there are some advantages and disadvantages of anabolic steroids. Some advantages of this drug allow the athlete to experience a sense of well-being, inner strength, and diminished fatigue, in which enhances their training. However, anabolic steroids are beneficial for some anemia patients. It is beneficial because it increases hemoglobin concentration and overall blood volume, which is very significant for patients with certain types of anemia. Also, another beneficial factor would be that it increases lipid metabolism, and so there is an increase of the breakdown of fats ingested within the body. There are also cons to this drug as well. Some disadvantages of anabolic steroids are liver damage due to increase of LFTs in some patients. Some patients develop this liver condition called pileosis hepatis, and which can be developed through the use of receiving oral steroids. A longer-term effect of the use of anabolic steroids are hepatic tumors, changes in reproductive behavior and physiology in which are well documented in many anabolic steroid users. Nevertheless, there are also changes in plasma testosterone, sperm density, and shrinkage of the testicles. Some men also develop breasts. Case presentation. A 23-year-old bodybuilder who has a great history of being in good health began to use anabolic steroids for his upcoming training program for a competition. The subject used both oral and parenteral forms of the steroid over a 6-week period and discontinued the drug 1 week prior to his competition. In addition to this, the subject's side effects reported during the case study resulted of an increase in libido, increase of frequent of erections, muscle spasm, increased acne, water retention, increased urinary output, increased frequency of headaches upon drug discontinuance, and increase in muscle mass, irrespective of an increase in training intensity. In conclusion, LFTs cause muscle breakdown in the subject induced by severe exercise and by intramuscular junction. All in all, anaerobic steroids have a great intense negative effect on the body of an athlete, specifically pertaining to bodybuilders. Anaerobic steroids does not only alter one's body, but it also increases health risks. Although anaerobic steroids have some advantages to it for other sick patients, such as patients who suffer from anemia, who need a steroid boost in their system to help bring their body back to normal speed, wherein the abuse of these anabolic steroids in healthy individuals, the negative effect it has on the body can puncture and damage the body's organs permanently. Anabolic steroids are not safe to use for healthy individuals.